Okay friends, let's start the next topic in CVS, that is congestive heart failure. Okay, what are the drugs used in heart failure? In heart failure there are two types you are going to categorize it: acute and maintenance treatment. Acute cardiac failure will be having different types of management, whereas management according to the maintenance therapy will be based on the echo findings. I'll be dealing it later. First we are going to see acute. Okay, in acute there are three classification of drugs. First is decrease in congestion, that is decrease the preload. Second is the drugs used in cardiogenic shock with ejection fraction less than 35 to 40%. The last is decreasing the afterload. Okay, first we are going to see the congestion reducing drugs such as furosemide, morphine, NTG or nitro triglyceride or glycerol trinitrate, both mean the same, NTG or GTN. Then neseritide. Okay, neseritide, it is a BNP analog. Drugs used in case of cardiac shock. Okay, cardiogenic shock, that is inotropes. Inotropes are used, inotropes like dopamine, dobutamine, noradrenaline and phosphodiesterase 3 inhibitors such as ambrinon and milrinone. Okay, nons. The last is decrease in afterload such as hydralazine and nitroprusside. These two drugs they are given only if there is a BP is normal or it is more. Okay, not in case of hypotension, because these cause vasodilation and decrease the BP rapidly, and the patient will again go for shock, and already in failure again shock will worsen the condition. The next is maintenance therapy. It is based on the echo findings with ejection fraction less than 40%. It's called as heart failure with reduced ejection fraction. If the ejection fraction is more than or equal to 50%, it's called as heart failure preserved ejection fraction. So what are the drugs used in case of reduced ejection fraction? ARNI. What is ARNI? ARNI is nephrolysin inhibitor. Sorry, I was not audible. It is nephrolysin inhibitor. Nephrolysin inhibitor. You are going to combine with sultans. What are sultans? They are ARBs. Okay, angiotensin receptor blocker. They are angiotensin receptor blockers. ARBs. They are combined with nephrolysin inhibitor. That is called as ARNI. The next is AC inhibitors and ARBs and beta blockers such as second generation and third generation like labetalol, esmolol, all those things, carbitalol, nebivolol. They are cardioselective. They are beta 2 blockers. That's why they are used. Next is ARA. What is ARA? Aldosterone receptor antagonists such as spironolactone, eplerenone, finrenone. Not milrenone. It is finrenone. Next is furosemide is also used to reduce congestion. Okay, in heart failure. Next is preserved ejection fraction with ejection fraction more than or equal to 50%. What are the drugs used here? Furosemide and again aldosterone receptor antagonists like spironolactone, eplerenone, and SGLT2 inhibitors are used initially here. That is dapagliflozin and empagliflozin. These are the drugs which are used in case of heart failure. Next we are going to discuss about the drugs used in case of arrhythmia. They are called as anti-arrhythmatic drugs or anti-arrhythmics. There are 5 classification of drugs here. What are the drugs? Class 0 is ivabradine, that is funny current channel inhibitor. Next is class 1, that is sodium channel inhibitors. They are lidocaine or lignocaine and mexiletine. Class 2 is beta blocker, that is second or third generation, esmolol and metoprolol. Class 3 is K plus channel blockers, that is broad spectrum, amiodarone and ibutolide. Okay. The next is class 4, that is calcium channel blockers, that is old generation calcium channel blockers, that is verapamil and diltiazem. They are weak vasodilators. Okay, it can be used as a property for antiarrhythmics. Okay, next is miscellaneous digoxin. It will inhibit Na plus K plus ATPase pump in the heart, thereby inhibiting SA node and AV node. Magnesium sulfate, it is used because the body cannot differentiate magnesium and calcium and decreases the calcium entry into the heart muscle and thereby decrease the arrhythmia. The last is adenosine. It will decrease the arrhythmia by stimulating the receptors called as adenosine 1 receptor. So these are the 3 main drugs you must remember in antiarrhythmics, and you must compare them and read. It will be easy for you. That is lignocaine, amiodarone and adenosine. What is lignocaine? Lignocaine is a sodium channel blocker, which is a class 1b antiarrhythmic. Next is amiodarone. It is a K plus channel blocker. it is class 3 antiarrhythmics. Next is adenosine, that is adenosine 1 receptor stimulant, it is a miscellaneous type. Okay, so where is lignocaine introduced or indicated? It is in ventricular arrhythmia. Next is amiodarone, it is indicated in AF, that is atrial fibrillation and atrial flutter. And adenosine, it is a drug of choice for PSVT. It is a life threatening, okay, it should be solved immediately or else the patient will die. So it is a life threatening tachycardia or tachyarrhythmia. Adenosine is a wonderful drug for PSVT. Okay, next route. Okay, route, how you are going to administrate the drugs. Lignocaine should be given IV, never oral, okay, because of high first pass metabolism effect. Next is amiodarone, it can be given by oral route and IV route. Adenosine is IV bolus, okay, it has very short TF, so it should be given very quickly like a bolus. So what are the side effects accordingly? Lignocaine has CNS toxicity, tremors and seizures. Amiodarone has pigmentation of the eyes or pigmentation of the body, it is blue man syndrome, it is called as blue man syndrome. Next is corneal deposits, okay, it will cause some named side effect called as cornea verticillata in eye, okay, cornea verticillata. Then pulmonary fibrosis, liver cirrhosis, optic neuritis and hyperthyroidism initially treated, and chronic treatment will lead to hypo, okay, chronic will lead to hypo. Next is adenosine. Adenosine has a side effect called as bronchospasm. So if a patient is having bronchial asthma and COPD and he precipitates PSVT, there is the drug of choice is verapamil. Okay, in such cases verapamil is given. Okay, thank you. If you like the video, please like, share and comment. Bye.